take a seat, we'll go ahead and get started this morning. I'd like to welcome you all here for what I consider a celebration of collaboration. My name is Cheryl Harmon, and I'm the Interim Senior Vice President for Provena's Central Illinois region. And this morning, I'd like to give you a little background on what brought us here today and the history behind the Medicare 100 and Medicare Plus programs in Champaign County. In 1984, then Burnham Hospital and the Champaign County Healthcare Consumers created the programs called Medicare 100 and Medicare Plus. The intent of the program was really to combat rising health care costs for our seniors in this community. The programs continued through the merger of Burnham and Mercy at Covenant and included about 1,100 seniors in order to develop this program. In 1998, due to changes in regulations and in the laws and interpretations, it was decided that the program no longer met the requirements set forth by law, and Provena Covenant at that time ended their participation. After repeated attempts to salvage the program and the relationship between the organizations, the Champaign County Healthcare Consumers filed their one and only lawsuit as a last resort. As many of you know and watched, this situation played out in the local media for a long time. After some very intense work by Claudia Lenhoff and the CCHCC with Provena throughout 2004, we're here to make an announcement about these programs. And with that in mind, I'd like to introduce Mark Weiner, the President and CEO of the Provena Central Illinois region.
Thank you, Cheryl, and again, welcome all of you to Provena Covenant Medical Center. As Cheryl mentioned, it's certainly no secret that Provena Covenant Medical Center and Champaign County Healthcare Consumers have been at odds over the Medicare 100 program for some time. However, today is a day of celebration, and it's with great pleasure that I announce that Provena Covenant Medical Center and the Champaign County Healthcare Consumers have resolved our differences and that we are reinstating the Medicare 100 Medicare Plus program. Reinstatement of these programs are effective immediately. So both programs are up and operational right now, and we'll be answering questions about that, any details that you may have later on in our program. As part of our commitment to creating communities of healing and hope, we're very excited to offer the community here in Champaign-Urbana another option to access affordable health care. And we, on behalf of Provena, we want to thank the CCHCC, the organization that we've been working with, to agree to partner with us to oversee the administration of this program. Now, I want to acknowledge that the program is not exactly the same as it was before, that there are some refinements, there are some modifications. I think it's important to acknowledge that we're very pleased with the new version of the programs, and I hope you'll find that the guidelines and the rules and regulations that pertain to this are going to be very easily understood and really user-friendly. We're encouraging anyone here or in the community who in the past was a former member of the Medicare 100 program to go back. We've got staff here from Champaign County Healthcare Consumer Group to answer any questions as far as what their immediate eligibility would be or how this would affect their prior status of being a member. Today is really one more example of our commitment and really our deep desire to work with the community to make sure that we're doing everything possible to avail all of the resources that we have to provide the greatest level of health care in our community. And with that, it's my pleasure to introduce Claudia Lenhoff, who is the Director of the Champaign County Healthcare Consumers. So, Claudia.
Good morning, everybody.
Good morning.
Thank you. Again, I'm Claudia Lenhoff. I'm the Director of the Champaign County Healthcare Consumers, and for many of us here, this has been a tremendous journey, and this is an incredible day and a celebration. It's been a very long road. I think most of what needs to be said has already been said, but I just wanted to, to say a little bit about the, I'm so grateful to the people who are here in this room. Everybody who is here has done something to help make this day happen, whether it was 6 years ago or whether it was in the past year. But basically when the programs ended, it was a devastating situation for our members. The value of these programs cannot be overestimated. It's not just in the dollars that people are going to save and that people were saving. We saw the value of these programs firsthand when the programs ended, and we saw people struggling with facing tremendous medical debt and making decisions to forego health care that they needed. There's a little bit of grief here because we saw a lot of folks go without health care that they needed because they didn't want to incur those debts. And so a lot of us here bear that grief. But today we don't have only grief. Today we have joy in the reinstatement of these programs and in the community collaboration that has brought us here together. I guess one thing that I wanted to say is that when we started out, fighting for the reinstatement for these programs over 6 years ago, we did a lot of community organizing, and a lot of y'all were part of that. You came to protests, you came to prayer vigils, you came to community meetings, you wrote letters, you signed postcards, you made phone calls. I think we talked to everybody and God to try to get these programs back. And you all were part of that, and we're very grateful for your work on that. The other way that we kept the struggle alive, of course, was through the lawsuit. It was the first and only lawsuit that our organization has ever filed. And we had a lot of ambivalence about it, but we felt that we had no other option. And we filed that lawsuit, and we're very grateful to have it settled. We settled it out of court through good faith and friendly collaborations. And I have a lot of gratitude to Mark Weiner and Cheryl Harmon, and especially Cheryl Harmon. And I spent a lot of time going back and forth, with the documents, trying to do the best that we could. And then we had help from our attorneys, making it final. And so we're very glad. And I'm very grateful to attorney Robert Kirshner, who did this work pro bono for 6 years and longer. So everybody did something to help. And we're very proud of today and very glad to be reinstating the programs. I want to say that the time is right for these programs. The reinstatement of Medicare 100 and plus programs could not come at a better time. Right now, people on Medicare need tremendous out-of-pocket relief. The out-of-pocket expenses are escalating, and there's not a better time to bring some relief to folks. So we're very excited about this. In terms of the programs, as Mark said, as Mr. Weiner said, we're basically starting from scratch. It's been more than 6 years since the program ended. Many of you here are former members of the program, so you remember all of the benefits that they had, and we built up those programs over years. The programs had been around for 15 years. In 15 years, we had hospital benefits, we had physician discounts, we had pharmaceutical benefits, vision, and other kinds of things. Today, we're starting from scratch, but what we've got is the centerpiece of the programs, the foundation of the programs, which is the hospital benefit. And we're off to a great start, and from here, we will build it up over time. But the first step is going to be getting folks re-enrolled for the programs. And what we're going to do today is the people who are interested in signing back up for the programs, we have a form that we will fill out to take down your name and your information, and we will be calling you next week to make appointments, to make sure that we can help fill out the paperwork and turn in your documentation. And then once people fill out the forms and they come to Provena and you get qualified, we'll be sending you letters to let you know which program you qualified for and what level of discount. And then if you are in Medicare 100, you will have a card, a white card that looks like this. If you are in Medicare Plus, you will have a card that looks like this, and it'll tell you the level of discount that you get. I want to also say that these cards double as a weapon because they're very sharp, so that's an extra benefit for people. But basically, the programs are going to be somewhat similar. Medicare 100 will provide a 100% discount off of your hospital-based charges for Medicare Part A. And right now, the deductible for Medicare Part A, if you are hospitalized, is $912. So the people who qualify for Medicare 100, that's a huge savings, and I think people can recognize the value of that right away. That gives people peace of mind that if your doctor says you need to be admitted to the hospital because you need a certain procedure, people are worrying about the deductible, and those folks in Medicare 100 will have that peace of mind of knowing that that will not stand in the way of their health care. The Medicare Plus programs are for people with slightly higher incomes, and they offer discounts on a sliding scale ranging from 99% discount down to 1% discount. And I think that most of you will benefit tremendously under that program as well. And over time, we will work together to build these up and add more benefits. I know some folks have already been talking to their physicians about participating and so on. But the focus today is on the foundation and the centerpiece of the programs, and that is the hospital benefit with Provena Covenant Medical Center. Again, I can't be more grateful for this day, for all of you and all that you have done, and also for the folks here at Provena Covenant who I think what we're seeing here is a real embracing of our community, and the community in turn is embracing this hospital, and I think together we're going to do great things. So thank you very much. I would like to now introduce Ms. Dorothy Chrysagas, who is a longtime member, and she's going to come up here. I'm going to hold the mic while she speaks, and she's got a few words to say.
This is a good day in one way, but in another way, it's too bad that my husband isn't here to see this. He was involved too. But for all the seniors that have belonged before, thank goodness it's back.
Thank you very much. Just real quick before I step down, I wanted to show people, Dorothy actually brought this with her. Her husband, Gus Chrysagas, passed away recently, and many people in this community knew him and loved him. And Dorothy was going through his materials, and she found this pill box from a long time ago that talks about the Medicare 100 and plus programs. And we're not sure how old this is. We know that the programs were formed in 1984, and when you open the pill box, you see that it has 8 slots instead of 7, and so we think that the weeks were longer back then in 1984. So we'll have to do new ones, but this is a keepsake for sure. Thank you very much. What happens now?
Questions?
Okay, at this point we're taking questions, and actually Ellen is walking around and she's got a microphone. Just so if you have a question, you can raise your hand and she'll bring you the mic.
It's not a question. I just wanted to say I still have my Medicare Plus card from 1991.
Oh my gosh.
I never threw it out.
Excellent. Well, the good news is now you'll get a new card, again, that doubles as a weapon, but the other thing is you will actually be receiving, you personally will probably be receiving a greater discount than what you did under the old Medicare Plus.
I want to ask, I know Medicare is usually for seniors, but I have kidney failure and I've been dealing with transplants and things, and I'm on Medicare. Would that also be covered by this?
Yes, basically the qualifications for this program, for either one, either the Medicare 100 or the Medicare Plus program, are that you be a Medicare beneficiary and that you have Part A and Part B. Do you have both?
Yes.
Yes, very good. So this program really is for anybody with Medicare who has Part A and Part B and meets the income guidelines. And the income guidelines are actually very generous. And the pink form that you have on the back side of it, it tells you the guidelines under each of the programs. But basically, we will assist people to fill out the forms and to document their income, and if there are any extenuating circumstances, like if somebody has really high out-of-pocket costs for prescription drugs, and that really affects, their income, we will help people to document that, and then the folks at Previna Covenant are going to, go through the applications and then make the right determination to figure out the discount for people. But yes, you can be a member of Medicare 100 or plus.
In December of '97, I had a detached retina surgery. Well, they didn't have surgeons at Covenant or at Previna or at Christie Clinic. And so I had to go to Carl, and I ended up paying $704. That was back in '97, and you said it's $912 now. So I had to have a supplement because I had cancer 20 years ago, and I have to take what they call these preventative visits. And I ended up, always had to get a mammogram and a pap test. And here I was paying for my own pap test because it was private, that they didn't think I had cancer, I guess. And because one record is in one Christie, and I go to Lady Doctor in Christie on Windsor. So I was wondering how they would do that. I didn't join Health Alliance because I didn't want to change doctors, but I ended up with, when my doctor left, I'm on the second different doctor already, so, and that puts my blood pressure up.
And then you got to deal with your blood pressure. Well, I think what's going to happen, I don't have a particular answer, but one thing that I can tell you is that now that we have the programs together and we're working together, already we work on a weekly basis with the folks from Previna Covenant. So if something like that were to happen to somebody, again, now when we have the program reinstated, I think, what we're going to be doing is we'll have a team of people who can work with you and, try to make sure that you get the best care in the most affordable way possible. And I think by working together, we may be able to find some better solutions for situations like that, so that you don't end up taking such a hard financial hit, even as you're struggling with these healthcare problems. And, some of those things we don't necessarily have, there's no program for that, but I think what I can guarantee you is that we will do everything possible to work with people with the circumstances that they are facing. And now you have the power and the strength and, of the two organizations working together to take care of folks.
I biggest worry is, what do we pay per month or year or something?
For this program, you don't pay anything for this program. Basically, we'll just work to sign you up, and then you get the discounts. And, in the future, if we build on other benefits, there may be things that we end up, asking people if they can contribute to it or something, depending on what it is, but there is nothing that we would ever do to make any kind of financial hardship for people. But right now, to sign up and to get the hospital benefit, you pay nothing. We just sign you up, and then you qualify, and then, and that's it. So it's a little bit different than it was in the past, that way. Thank you. You're welcome. Any other questions?
Is Previna going to reinstate the, I think it was called the Senior Advantage Seminar Programs?
That's a separate program, and we're always looking at other opportunities that we could be revisiting for improving the services and the accessibility for the community to healthcare services. But as of today, this announcement is really exclusively to the Medicare 100 and Medicare Plus, but we're certainly looking at that.
Anything else? Okay. Well, with that, then I want to again say thank you very much to all of you here, all of the people who couldn't be here. We talked to a lot of our former members and they're very excited. Many folks can't really get out easily anymore, so they weren't able to be here, but they are with us anyway in spirit. And again, I want to say a deep and heartfelt thanks to the folks at Provena Covenant here, Mark Weiner and Cheryl Harmon, and then Beth and Vicki and all the other folks that we are working with to do this program. Folks should feel free to stick around, get some food, have a little celebration, ask questions. If you have questions, you can go and talk to healthcare consumer staff members and advocates, or come and talk to us. And again, thank you very much.
Can I suggest a standing ovation for what they've done?